today's episode, the fourth of 7, is going to be here with Eva Henje. So Eva is a professor at the University of Umeå in Sweden. And she's a neuroscientist and a child and adolescent psychiatrist. And she's very unique because she is linking what's happening to our mental health with the global economy and the polycrisis that we are facing. So I don't know anyone quite like Eva. And she's also a mental health activist and educator. And we're so happy, Eva, that you could make it here today.
Thank you, Anja. Yours. And I want to add that there is a specific focus on the mental health crisis in young people, but I think it's applicable to all of us. And I also wanted to add that everything you said about me is true. And I think I want to add that when I'm speaking here, it's not, I don't see myself a representative of academia or child adolescent psychiatry, but I feel that I need to combine different paradigms and speak more from a moral obligation to try to communicate what is actually going on. And also from my heart, from being a mother myself and a grandmother, I feel this is hugely important. So having said that, I do have some PowerPoints to show, and bear with me, I'm from academia, so maybe you'll be overwhelmed by a lot of information here. And in that case, you can just close your eyes and listen, and that's completely fine too. And then we'll try to disentangle things and sort things out in the Q&As afterwards. But I'll try to kind of move on through my slides in one go here. So I will share.
Yeah, you should be able to share now.
Yep. So I've chosen to do you see everything okay now?
It looks fine, yeah. And
okay.
I mean, everybody on their computer can decide how they want, whether they want to have gallery view or speaker's view. That's up to every single one, but we can see your slideshow fine.
Perfect. So I've named the talk Perspectives on the Metacrisis and Depression in Young People, and also how to love this world, because I think that is the biggest antidote to depression for all of us. And I have an opening poem here that is about just that. That is by Mary Oliver, and we have just the early spring here in the northern part of the world, in northern Sweden, where I live. And she says, somewhere a black bear has just risen from sleep and is staring down the mountain. All night, in the brisk and shallow restlessness of early spring, I think of her 4 black fists, flicking the gravel, her tongue like red fire, touching the grass, the cold water. There is only one question: how to love this world. And I'll come back to this later on. And in between that, I want to talk about the metacrisis and try to define it a little bit, since it is a big concept, and then talk about what depression is, how common it is, and some of the individual pathways of getting depressed, and also some systemic mechanisms of how this occurs, especially in the context of the metacrisis. And then finally, what we can do about it. And what we can do about it is, I don't want to frame that primarily from a psychiatric point of view, but more to all of us as parents, allies, teachers, relatives, community members, and really break it down into principles that we can understand all of this from. So if we start with the metacrisis or the polycrisis or the time of the sixth sun or the Kali Yuga or the big turning or however you want to name it, I have learned a lot from a person called Arno Lada in Costa Rica, and he is talking a lot about the driving ideology of late state capitalism or neoliberalism, and some common assumptions that we kind of inherit with that paradigm that is of relevance to understand where I'm going. So here are some examples. To assume that humans are inherently selfish and competitive, like we are separate as humans from nature, and we have the right to do what we want with it, and that we need hierarchies of power. Also that rationality and materialism has a big overweight over other ways of other ontologies, other ways of looking at the world. And also the scientism that for things to be true, they need to be kind of proven by science. And this is a entrapment that I've spent a few decades in. And also the assumption that monetary gain is the ultimate goal of life. And we see this all over. And it also, of course, plays out in the current economic system, which is by now a complex adaptive system that is run by artificial intelligence and self-running algorithms. So it's not like one or two persons to blame. It's more like this has almost dissociated from our kind of normal everyday life. And this system, it requires perpetual growth because it's a debt-based economy. And therefore it's self-terminating logic, because we all know that we live on a global planet, planet Earth, which has limited resources, and we already see where it's going. And this thinking is also brought in from Jason Hickel and his books and his writings. He has a great way of explaining all of this. And what kind of implications does this have? Well, the impact of the metacrisis reaches everywhere, and it threatens the very core of life itself, not only human beings, but as we all know, ecosystems and more than humans, and the whole life supporting system that we are part of. And the fact is that we are all complicit with it, and there are no quick fixes or no solutions when we look at this from inside of the system. It is as if we are entrapped in multiple and complex double binds that are created at different levels in the system. So they are often really difficult to see, especially since we are often having assumptions about the state of the world, so we don't see it. And I want to say something more about those double binds. It is a feeling of I must do this, but I can't do it. It's a sort of entrapment, and this I borrowed from Nora Bateson and also her father Gregory Bateson, that you probably know of, who talked a lot about double binds more from a psychosis point of view, but you can actually apply this also to systems. And it is a process in which an individual or a group receives two or more mutually conflicting messages at the same time. But it's not about only that paradox or the conflicting polarity. It's more complicated, because typically the demand is imposed upon the person by someone in authority position. And the demand itself is impossible to fulfill because there is a broader context that forbids it. And each demand is on a different logical level. So if I take an example from my life within the university world, where I do my research, we are told that we are supposed to collaborate and take care of each other. And at the same time, the system is rigged in a way, so we are always in competition with each other about the same resources and grants and things like that. And they call the university a center of excellence, which implies that somebody is supposed to be better than somebody else, which is not really a collaborative environment. So we get those conflicting messages, I think our whole world is entrapped in a double bind, because we all know about this self-determinating logic, and at the same time nobody has the capacity to stop what's going on. And it's very stressful for us humans to be in double binds, and it's very helpful to understand them and to identify them, at least, so we know what's going on. And what I'm aiming at with this is that context-dependent problems and symptoms, as depression, for instance, cannot be compartmentalized and solved separately from everything else. And this is why we have created this webinar series where we speak about the metacrisis from different interlinked and entangled views. Instead of separating them, we want to highlight that they are actually very much connected and have the same ideological root causes. So for instance, if we look at Agenda 2030, the sustainability goals, they're all boxed in a weird way. And of course, it's not possible to address one of these boxes without addressing the others. It's self-evident. And it's the same with the way we kind of diagnose people within psychiatry. We box people in psychiatric diagnosis that have no relationship to the context that the people live in, or what is impacting them in terms of relationships or the metacrisis or anything else for that matter. And if this is what we want to protect and what we want to caretake, this is a huge discrepancy and also kind of a double bind, because we all know that life is something different than those boxes. And at the same time, this is the way things are being addressed, and we are all being boxed in this way and limited also this way. So I would rather look at our, the metacrisis is a root system situation that is impacting the whole tree. And we can't address one problem by addressing one branch or one leaf and trying to solve it, because it depends on the nourishment, and it depends on the mycelium, and it depends on the earth, and it depends on microorganisms and all kinds of things. It's super complex, and it's almost ridiculous the way we think that we can understand it from just one branch. And with this seminar series, we also want to, we call it Feminine Futures, but also it is not about women only. It's like it's more of a weaving approach, I would say, where we try to, instead of looking at one color at a time, bringing it together and understand it at one weave of interrelated and entangled processes. So with that, I want to move on and talk about how we define depression and how we can look at it. And the way we address it within psychiatry is to ask both ourselves what's wrong with the patient, but also ask the patient what is wrong with you, implying that there is actually something wrong with this individual or their brain. If this is a person and the person contains all the multiple systems and behaviors and experiences that entails being a human being, then I, as a psychiatrist, I come along and I have my diagnostic manual with the symptom criteria of major depressive disorder that looks like this diagnostic entity. And I ask all the questions that are linked to those symptom criteria and see if it fits into this patient's symptomatology. And it's not only that I test for depression, I test for all possible diagnoses that I can think of. And this is the way we are supposed to do it. So I also test, for instance, for generalized anxiety disorder, or for ADHD, or for anything else that this could be. And why do we behave like this? Well, in psychiatry, we have this idea that these symptoms, when they are clustered in a certain way, are medical disease or medical disorders. And we have spent a lot of resources doing big trials to see and find out what is so-called evidence-based practice. So each of these diagnoses should ideally be linked to one evidence-based treatment. So of course, then people get multiple diagnoses. This is not especially so actually for young people, because they don't really fit into this manual very well. And they're also even more context dependent, I would dare to say. So young people end up with many diagnoses and many treatments at the same time. And this is not very good. This is what the manual looked like. It's kind of our psychiatric map of the territory. It's a classification system. And when we do these studies, we take then people who are categorized as having depression according to these criteria, and we randomize them into two groups, and one get the treatment, the pill or some other kind of intervention that we want to test, and the other group gets something else, maybe placebo, nothing at all, or a waiting list or something else. And then we test before and after, and then we see if there is a mean value difference in the two groups. And if that is significant, we can say that this intervention is proven better than nothing at all, or proven better than something else. And then we call it evidence-based. And then we pull a lot of data in systematic reviews and meta-analysis and so forth. And we create clinical guidelines that are like recipes for how to treat patients with these disorders. But the problem is that this is based on mean values. It doesn't look into each individual. So in the individual case, we have no idea whether this evidence-based treatment is going to be helpful, which is highly problematic. It is as if we take wild, living, unique human beings with all their complexities, and we try to put them in a little box, like I try to illustrate with this picture. So when we define depression this way, we can do large-scale surveys in the population or in schools and so forth, and people self-assess or self-report how many of these symptom criteria they actually have. And what we see is that this is pre-COVID pandemic numbers. We can see an increase, especially in young women aged 12 to 25. There is where the takeoff really happens, with a big increase of depressive problems. And then from having been around 15, 17 point prevalence of depression, it started to dramatically increase and actually double during the pandemic. And nobody really thinks that this is due to the virus itself, but rather to the context. Young people were scared. Young people were deprived of their community, their school environment, their everyday life, and the threat situation increased in many ways. So today we have, I would say, a global pandemic of depression, and it's not only in Sweden. The numbers are similar across the world, at least in the Western world. And in the rest of the world, we don't have that much data to lean on, so we don't know exactly what it looks like. But if you look to Australia, England, Denmark, etc., you can see this increase the last couple of decades, and even more steep if we go post-pandemic. And what do we do then to treat depression according to this way of looking at things? Well, we are very prone of prescribing drugs, and antidepressant drugs are being prescribed in increasing rates in Sweden, especially, I think in other countries as well. The biggest increase is again at young girls, 15 to 19, or actually that is also going on up until 25. So a dramatic increase today, around, well, actually more than 10% of all young women that age group are prescribed SSRIs, which is antidepressive medication. So we're trying to fix human suffering with these kind of medications. And why is this problematic? Well, in some cases it helps. I'm not against all medications at all in all cases, but it's way too much as the situation has developed. And the problem is that when we look at those meta reviews, there is a big Cochrane database, for instance, there is no proven clinical effect of these medications for young people. The situation is a bit different for grown-ups, but for children and adolescents, no proven clinical effect. And we do know that there are some side effects which are highly problematic. And one of the ones that worries me the most is that people on SSRIs can become less depressed, but they also become less everything else. So we have this situation of emotional numbing. And there are other also problems with sexual dysfunction, which is really difficult in this age group, weight gain, sleeping problems, concentration difficulties, aggressive behavior, and actually worsening of depressive symptoms and suicidal ideation. That is not uncommon, especially in the beginning. And also, it's important to know that sometimes it's difficult to taper out these medications. So what happens is that it's easy to prescribe, but it's difficult to taper out. And therefore, often young people are on these meds for years and years. The other thing that has become widespread within psychiatry and also within general practice, I think, is to try to kind of manage symptoms and increase coping skills. And we do that by using our prefrontal cortex to top-down regulate other parts of the brain where we have emotions and feelings. And we try to kind of fix the symptoms by increasing our cognitive control and rational thinking. And this is very difficult to do for young people because this is the part of the brain that doesn't develop until, it's not ready developed until around the mid-20s. So we're really asking a lot of young people to try to propose this strategy. And often those treatments are manual based. It's maybe 10 or 20 sessions. And it can be a temporary relief, but we don't get to the root cause. And the other parts of the brain that we're trying to control top down is, for instance, the limbic brain with amygdala, where we have emotional processing, the reward systems, where we get reward for things that we do in life, and also even the brain stem. So these are the deep parts of the brain where trauma and overwhelming experiences are stored and where we can get triggering responses and what we try to kind of control by top-down regulation. But there are also other strategies that I will come back to regulate bottom-up instead, which I think is a lot more helpful, especially for this age group. So in summary, we can say that psychological suffering is made a medical diagnosis or a disorder or a disease. And it's also the kind of blame is put on the individual so that the individual think it's something wrong with them and their brain, and that this needs to be treated with medication or with individual psychotherapy, sometimes group therapy also. And we know by now that this approach is not very effective, and we know that the focus is to reduce the symptoms, but not actually to heal the root causes. And we put the blame on the individual, which is very disempowering to think that is something wrong with you. And we know that the numbers continue to increase. So what could an alternative definition of depression be? How could we see this differently and understand it differently? Well, after several decades in child psychiatry, I have come to the view that for most people, not for everybody, but for most people, depression is a natural response to long-term toxic stress levels, especially for young people that don't have enough inner and outer resources to deal with these challenges, and no autonomy, no solutions on board. So they are entrapped in a kind of double bind where they get into a situation of overwhelm. And how does the body and the nervous system react to this? Well, we have a very intelligent threat response strategy in our bodies, like all mammals do. And when we are threatened, the first thing that most human beings do is to engage our social engagement systems. So we seek support, we seek validation, we seek help, we seek protection from the group. And if we don't have access to that, we tend to go through an acute threat response, which is that we first get an orientation response, we kind of stop and try to orientate to what's going on, and then we can go into shock. And if we make the judgment of the situation that we can fight for our life, that's probably what we will do. This is mediated through the sympathetic nervous system. If we can't fight, if the aggressor or whoever it is too big or too powerful, we will instead try to flee or run away. And that is also mediated by the sympathetic nervous system. And if none of this is possible, we have no choice but getting immobilized, and we freeze. And that is a very painful state to be in, where we have the whole anxiety and fear systems running with adrenaline and noradrenaline, and the fight and flight response are full on, but at the same time, we can't move. We can't do anything. We know what we want to do, but we can't do it. And if the threat situation gets even worse, if somebody is actually violating our bodily limits, if we get stabbed, or if it's a rape, or our bodily integrity is violated. I mean, this also applies for animals. If a lion comes and attacks and put its teeth into our leg, we will probably have what is called a flop. These states can be named different things. I've just used this name for this presentation. But at this state, we lose sometimes consciousness, we lose tonus in our system, so we kind of flop. And we also get numbed, so we don't feel anything, we don't feel pain. And for an animal, when this happens, if the predatory animal see the animal go into a flop state, then they often think that this is already dead, the animal, and it takes a break to rest and recover. And when that happens, sometimes the animal who's been attacked kind of starts to shake and get all jittery and go all the steps back to be able to kind of get the power to run away again. For us humans, that happens more seldom, so we get sometimes chronically entrapped in those freeze and flop states, and they are very, very similar to a depressed state. This is another way to explain the same thing. So if down here at point 0 there is no stress at all, and we are relaxed and with our friends, and then we leave a party or this gathering, and we go out in the night and we go alone, and we hear steps coming from behind, our stress state will increase, and we get to a sympathetic activation here. We get increased heart rate, we get a lot of blood in our legs to be able to run, etc. And we continue to walk, and we hear the steps coming closer, and we turn around and we see that actually somebody is about to attack us. Our stress levels will go up, our blood pressure will increase, and we'll soon reach a state of overwhelm. And if we then get threatened to our life with a gun pointed at us or something like that, we'll probably hit the point of overwhelm quite quickly, because we can't maintain. It's very costly energetically to be in these high stress states. So what happens is that there are what is it in English? Endocannabinoids that are being released in the system, so that we go into these dissociative states, which is the free states that I described before. And if we then actually get stabbed, we go into an even more dissociative state where we lose the tonus, like the flop state that I was describing. And then we have a very high release of opiates that gets released in the body, so we don't feel anything. So this is the acute situation that happens. Some of us live in this kind of sympathetic overdrive for long periods of time. I mean, the whole modern world is based on us running around in state 1 or even state 2 for long periods of time. And we have different difficulty sleeping, we are constantly anxious, we have muscle tensions and all of this. And the fact is that some of us also live in chronic dissociative states, in these chronic free states, or even more severe states of dissociation, where we are numbed, checked out, and not fully participating in life. And here is where I find many of young people who seek help for depression within child psychiatry. And of course, if we give them SSRIs, they get further numbed out. And instead, they need help to start mobilize and start to go back through this curve and have the support enough to be able to feel the feelings that was too overwhelming here, to be able to come down to baseline again. So here is where things are shut down in the deep parts of the brain. And when it's dissociated, we don't have access to what's happened. It's shut away. And there is a big study that probably a lot of you have heard about, that's called the Adverse Childhood Experience Study, that shows that these kinds of chronic, stressful, toxic stress levels during childhood, especially when the brain is developing, disrupt normal neurodevelopment, and it creates social and emotional dysregulation, and sometimes even cognitive impairment, and it has implications for both somatic and psychological health, and even early death. So this is very well studied and very well known. So in fact, this professor teacher at Harvard University has been devoting his life to study the implications of early abuse and neglect. And he says that it's probably accounting for almost half of the risk for childhood onset psychiatric disorders, which is a lot that could be prevented. And on top of that, we have other ways that children and young people's human needs are being violated, such as safety and connection and autonomy. And we have everything from attachment ruptures to loneliness that we saw during the COVID pandemic, with also the isolation and social exclusion, marginalization and bullying that is happening on top of what is happening early on in life. And furthermore, as we all know, today's children are facing enormous challenges that we in our generations have not grown up with. All these tipping points are being out in the red zones here. And of course, this creates a pressure from the outside and into the individual. So we have all these pressures coming in to the individual, which is impacting the way we feel and the way we suffer. So to say something about the metacrisis and the links, I think that is becoming more and more obvious to you here. And I don't mean to present this as lists that are inclusive of everything. It's just a few mechanisms that I want to highlight because I think it's important to understand them. So we do have actual threats of extinction and a collapse of the world as we know it. And young people know this, even if we don't name it and if we don't talk about it. And there is a lot of uncertainty, volatility and unpredictability in their lives. Things that were valid in terms of education and decisions about the future are uncertain at the moment. And they are also subjected to divide and fragmentation and polarization in ways that wasn't possible before through social media. And many young people that I meet, they feel in this double bind of increased pressures to perform in a system that they don't believe in. The education system is kind of rigged around the old model, and they feel it doesn't prepare them well for the future they are facing. And there is also lack of grown-ups and elders and ceremony and ways that we can support young people to feel the pain, and people who in our age who are actually willing to feel the pain ourselves, because that's necessary too. And how can we create communities and ways to do that? The effects of social media and AI, I think Camilla has talked about here already, but some effects that are linked to mental health is social exclusion. They are all based on that. And this is the strongest predictor for depression that we know of. And it also drives a culture of hypernormalization and monoculture. We are supposed to wear the same things, the same clothes. We are supposed to look the same way. And the little zone of what's normal is being more and more closed off, and more people don't fit in there. And it creates a lot of suffering for young people as well. And also, it's this whole thing about faking identity rather than belonging for who you are. And it's also, of course, a way to disinform and to market things that are unhealthy. And young people sometimes almost believe that the spaces on social media is like their living room, and they are putting a lot of personal stuff in there, and a lot of their kind of view of the world is shared in a kind of pseudo reality that we create with social media, with no real people. So we kind of become disembodied that way as well. And with that, we also lose connections and become inherently lonely. And then the speed, the whole economic system is speeding up and want to produce more and more and use our minds and our bodies to produce more. And our biology has a limit. We can't digest food quicker, we can't sleep quicker, we can't grow up quicker, a baby can't grow quicker. And if we try to do that, we also age and die quicker. And we have shown this in biomarker research, that actually the telomeres, that are the end caps of the chromosomes, that is a marker of biological age, gets shortened with chronic stress. So this is not something that is helpful either for our bodies and our health. And then we have, with this speed and with all this information, we have no time or no support to process the grief and the overwhelm and the losses. So the only option is to shut down and go into depressed states and give up and go into those chronic dissociative states that I was talking about before. Another pathway is that we get hyperinflamed, and there is an accumulation of pollution and toxins in our systems, and the inflammation also increases by lack of movement, And then we have, in addition, psychiatric drugs and other ways to numb out that can also drive inflammation and kind of load our system in ways that make us feel worse. And of course, with this kind of tempo and with this agenda and these kind of ideological root causes, there is a deprivation of space, there is a deprivation of soul, and there is a deprivation of community and ceremony that we humans need. And we are kind of socialized to forget that you are embedded in a part and part of a living intelligence, and that our rational mind is just a little small compressed fragment of a multidimensional and a very mysterious consciousness. And that life actually is sacred, and we are here to caretake it and protect it, not to destroy it and extract it. And in all mythopoeic traditions, across cultures, across times, there are similar original instructions about what I was just saying, about what is needed and what our place is in the more intricate web of life. And we are kind of programmed to forget all of this, but deep down inside we know and we remember. And what can we do to kind of evoke that memory? So I'm just going to spend a few minutes here about what we can do about it. And of course, the easy answer is to say that everything that counteracts what I've just mentioned is what we can do about it. And again, these are not just lists to follow, these are just examples. And I want to give examples that are available to all of us. So this doesn't come from me as a researcher, it doesn't come from me as a psychiatrist, it comes from me as a mother and grandmother and friend. And I think it's really important that we create resilience and resistance at this point and protect our young people from what's going on in ways that they can get empowered enough to take part in creating a future that is worth living for. And one thing that is important is to, at least inside of ourselves, redefine what mental suffering is. And one example of how to do that is the power, threat, and meaning framework. I put the link down there if somebody is interested to learn more about it. It's a very interesting initiative from England that explores negative operations of power and what kind of threat responses those negative operations of power evokes in us, and the ways we handle them and the ways we have been learned to respond to them. And it postulates 4 simple questions that we can ask ourselves and each other. And that is, what happened to you? How did that impact you? And what did you do to survive? And what meaning did you make of it? And this is a way to kind of understand a person's lived experience, lived subjective experience. It's not a way to approach things from an objective, medicalized point of view, but more to put things in context and increase our positioning and our understanding of how things are interlinked. And what the power, threat, and meaning framework allows for is to recognize multiple and interrelated contextualized pathways of impact. It is the food, it is the school, it is the economy, it is the ecosystems collapse, it is violence, it is all of it that is impacting our system and how we feel. And here we can also consider developmental aspects and understand how especially young kids are being more vulnerable to context, and that can also be considered, which is not very much considered in the DSM system. And we can also make meaning of our lives this way, which is very empowering. And I think also it's relevant to say that we can practice safe inner spaces, how to create them. by slowing down, by training embodiment. It can be Tai Chi or walking in the forest or dancing or doing yoga, something that makes us move and come out of the dissociative freeze and flop states, and increase our sensitivity and our interoceptive awareness and move out of numbness that way. Not feel bad because we're feeling a lot of things, but see it as a resource and an asset. And actually practice feeling emotions. And then I was talking before about bottom-up regulation, and that is anything that calms the limbic system and the emotional brain from bottom up. And what we have used a lot in the programs that I've been part of developing is breathing exercises, for instance, to use slow paced breathing to calm down the limbic system. It can also be simple things like tapping one's body or squeezing to feel that you come back in to the body, and using the senses to smell and feel and listen. All of that is bottom-up regulation. And then practicing safe groups and communities. How do we do that? Also really, really simple things that you all know, but just to put it here, also to name it, and what Local Futures is all about, to be local, to live in relationship with real people on the land. It's very protective. And to repeat, to be in continuity, to create predictability, that creates safety in groups, and developing trust and transparency, being authentic, and try to be inclusive and non-judgmental, and really continuously assess one's own prejudice and attitudes, and validate each other, and be in some kind of cultural humility and compassion for each other and for oneself. And then staying with the trouble together and feeling all those feelings that were too overwhelming to feel alone. We are very social beings, and we need to be held sometimes, and we need to be allowed to feel all of what is overwhelming when we are all by ourselves. And this way we can move out of these states where we don't want to be, because young people need to be activated. They need to engage, and they need to learn about the waters we swim in. They need to learn to identify those double binds and to accept that there are no quick and simple solutions on board, and that we all are complicit, and analyze what is actually driving the depressive symptoms for me or for you. It might be different things, different processes, even though they are probably interrelated. And then unlearn and deprogram from all of this that is taking us away from the mysteries and from life. So the alternatives already exist, and it's a lot about the values that Local Futures are promoting, and that's why I'm so happy to be able to speak about this in this context. You all know about this. I'm just naming it here. I think also within those communities, reach out and create networks across the globe, like we are trying to do now, is really, really important, to know that we are not alone. And perhaps also reclaiming this sensuous and sacred animate state of being that has been the state of normal up until the last couple of decades. I just want to end by naming that we've been working on putting some of these practices together in a program that we call Training for Awareness, Resilience and Action, TARA. And we've been doing research about this within psychiatric settings to see if we can help young people with depression this way instead of in the medicalized way. And we are still analyzing the results, and we have not so much data to present yet, but this is a big project that has been going on in the United States and in Sweden for about 10 years now. That's what it takes to prove things by science instead of trusting your own intuition and wisdom. And it's a 12 weeks group program with 1.5 to 2 hour sessions and 2 facilitators. And some of the content is the bottom-up regulation and the education about trauma and dissociation in the context, and also about engagement strategies for young people and empowerment strategies. And here is some of the team from Umeå University. And with that, I want to end with another prayer or poem by Johanna Macy that you probably know of, that I think is appropriate here. She says, "You who will walk this earth when we are gone, stir us awake. You who come after, help us remember. We are your ancestors. Fill us with gladness for the work that must be done." And with that, I will end, and we will open up to questions. I thank you for your attention, and I wanted to put my website to be here also. It's not yet up, but there is a place where you can sign up for a newsletter, which I think is the best way to stay in communication with me. I have difficulty sometimes to manage emails if there are too many, but here you can sign up for this newsletter. Thank you so much.
Thank you, Eva. Your talk, even though I've heard some of the things before, it makes me almost cry every single time. Particularly to think that all these young people and of all ages are experiencing what is a natural reaction to a pretty world, and that to think that so many people are caught in a state of numbness or disassociation, the very people that are obviously sensitive enough to know things are wrong and whose sensitivity and compassion we need to change this world for the better. It's like, it's heartbreaking.
It's heartbreaking.
Yeah. We have a few questions already, and I'm sure there will be many more, because all of us, wherever we are in the world, are familiar with this mental health crisis, I'm pretty sure, in one way or another. And even if we are not out all there in the flop state, we have all been, and I think probably all are, in the state 1 or 2 of stress. For that's quite normal for many of us, I think. Well, starting here with a question from Mimo Tushimura. I'm very sorry if I don't pronounce your names right. I'll do my best. Who writes that according to Mimo, Mimo has heard that the suicide is most prevalent among young men. But what you were showing was it looked like there were more young women than men that had a high suicide rate. Can you explain a bit more about this?
Yeah, so the numbers that I present are numbers that show that especially young women are more depressed and suffer from depression. And they have also, at least this is Swedish data, so I don't know how each country, how this plays out, but they have more also suicidal ideation that is measured, and also more suicide attempts. But the thing is that the young men often use more drastic methods for suicide. So they have a greater risk of succeeding than young women. So that's kind of the flip side. Also, we don't see young men so often in psychiatry. They often have their depressive symptoms often play out differently, more as aggressive behavior perhaps, or antisocial problems. And some, of course, are depressed also and refuse to engage in school and social life and things like that. But it's different with completed suicides.
Okay, yeah. We have,
yeah. Timo was speaking. Because
sorry?
I think I don't know from which country or from which part of the world the came.
I don't know either. Maybe I was guessing Japan, but I don't know.
Yeah, I don't know the situation in Japan so well.
But I don't know if that was really true. But I think, yeah. So I might not necessarily take these questions in the order they presented, because but we will get through them all, I hope. Here's another one relating to the depression rather than to what we can do about it. From Alex Jensen, who says, it seems like seeing the largest social environmental situation and context that produce depression can be extremely beneficial by relieving sufferers of self-blame, which is what you were saying. But he also says, on the other hand, this analysis could potentially also make the individual feeling even more despair. If only the total system change will help them.
Well,
what do you think about that? Or how would you resolve this? Or how do you resolve this?
Well, I think it's a good question, and I think what we have seen, at least when trying to kind of present this to young people, is that they feel empowered by understanding that it's not something wrong by them necessarily. And now I'm talking specifically about depression. I'm not talking about all kinds of psychiatric problems that people can have, but I'm talking especially about depression. And that is often a state where you blame yourself, you think that you're inadequate, you're not good enough, something is wrong with you already, and then you come and get a diagnosis and prescribed medication to kind of fix you. And I think we have so much to gain or to win by using these 4 questions in the power, threat, and meaning framework, for instance, to show an interest for the young person's life situation. What do they think caused them to go into depression? We have done qualitative research interviewing young people about this, and most of them have had horrendous things happening to them, or they've been bullied in school, or they have had losses at home, death happening, they have had somatic disease happening to them, they have lost things, and they have stories to tell. And if we can inform them that in combination with the worry for the world is a natural response to shut down. It's not that all young people, it depends, it's age dependent, how much young people can relate their own symptoms to the state of the world. Often they live in a smaller world. In the Bronfenbrenner circles I showed, that sense of reality, the younger you are, the smaller is your world. But as you grow up, and by young adulthood, everybody knows that the world is in big trouble, and it's ridiculous to try to protect young people from that understanding. So what they need is to be validated in their worry, and they need to be in safe relationships where they can process what's going on. We all need that. We can't take away what's going on. We need to grieve it, and we need to process it, and we need to hold it in community. We can't do it alone. And I think that's what's so also terrible now, is that young people are so lonely. So they are sitting with this overwhelm alone in front of their computer without any elders or any parents or any teachers or any grown-ups who are willing to go there with them. And that's all we have, really.
Thank you. We have another question and a comment really from Dr. Quadri, who's writing in from, or who's here from Nigeria. And would you consider the effect of meditation and deep breathing on depression? But here I think more of, what can it have, how much of an impact can it have? Are you using that? And also, Dr. Quadri is mentioning food as medicine and nature clinics, which is, I think you already talked about that.
Yeah.
Community gardening, art classes.
All of that. All of that. Yeah. And that's often community initiatives. It's not happening within the hospitals or the clinics. That's what I'm kind of a message is that we all can help here. We can all help by naming this and creating safe places where these problems can be addressed. We don't need, sometimes, of course, psychiatric clinics are needed, and sometimes medication is needed also. And it's not that I'm saying that it's not needed at all, but it's not the solution to the big problems. They are in our local environments. And to answer the question about breathing and meditation, I think breathing is a very helpful tool. That's often the feedback we get when we do breathing practices with young people. And it's important to remember that they are not going to do hyperventilation or holotropic breath work or Wim Hof methods or things like that, because that can increase anxiety instead. But we rather practice very slow and gentle paced breathing, which is stimulating the vagus nerve that runs from the diaphragm and up to the amygdala and the brain, where we can downregulate by using breathing. And young people report back that this is so useful. This is what they use on the bus, in school. Nobody can see what they are doing. So that's a bottom-up regulation that really works for them, because often they are both anxious and depressed. They are not totally numbed out, but they also are in the freeze states or fluctuate between these states. So they have, ADHD symptoms and anxiety, and also depression, and sometimes more shutdown. So the breathing can be something that they can use to calibrate themselves. When it comes to meditation, that's much more tricky, because when they meditate, they need to be in a supported environment. Because sometimes what we have noticed with young people is if they sit down and try to meditate and slow down, more anxiety will arise, and they will get more anxious, or they will dissociate. So what they actually do when they meditate is that they dissociate. And if you sit alone at home with no psychoeducation around dissociation, you wouldn't know. So we have become much more careful by promoting mindfulness and meditation, and take it really slow. Sometimes we start with 1 minute and we increase it slowly. And if they space out or fade away or numb out, they will get techniques to come back, which is often moving their feet, or this kind of squeezing or tapping, feeling that they are in their body and nowhere else. So I think the embodiment practices needs to be practiced before meditation, until they kind of fully grasp what it is being in the body. So we don't promote dissociative practices. So that's more tricky, actually.
Well, I had no idea.
Yeah. And also I think self-compassion is a problematic, it's a problematic concept. No doubt that it's important to be able to be self-compassionate and to have compassion with others. But if you are living in a abusive relationship, or if you're living in an oppressed community, and being told to be compassionate is can increase the abuse or the endurance of taking the abuse, rather than stand up and take action. So I think all these concepts are tricky, and they need to be put in context, and we need to understand them in the local community. Yeah.
Good. Well, here we have got two questions that are somewhat related, so I'm going to take them together. One, we have Fabienne, who's saying, what's your take on transgenerational and/or individual trauma? How often are dissociative states hinting at trauma? Well, let's take that one first, and then I'll take the other one that sort of relates to the intergenerational afterwards.
So can you repeat to me the...
Yes, what's your take on transgenerational, I guess, and/or individual trauma? How often are dissociative states hinting at trauma?
So those are two different questions.
No, that's from the same person, but yeah, let's take that one first.
Yeah, so I'll take the one about whether dissociation is hinting at trauma. And I think the A study, the adverse childhood event study that I mentioned, there were 26,000 people who were assessed for childhood trauma, who were grown-ups seeking general practice for different conditions. And they report on things that they do remember, which means that those incidents and those events are not completely dissociated. So that is a tip of an iceberg, probably, because dissociation means that we don't fully remember what happened. And therefore, screening for trauma is, yeah, we're gonna capture some of the problems, but actually what we have started to do in my research is to screen for dissociation instead. Because if people check out, if they are numbing out, if they have all these kinds of dissociative symptoms, that they are feeling that they are disembodied, they are feeling that they are out there somewhere, they are feeling that they are unreal, or they are feeling that they are dreaming, they can't remember things, they have memory loss, then yes, we start to consider what is this about, and is it linked to some kind of adversity or trauma that has happened. And I didn't go so much into detail with the diagnosis of post-traumatic stress like PTSD and complex PTSD and developmental trauma. There is a big debate. And, you know, acute overwhelming trauma like a car accident or one rape or something like that cause more of flashbacks and anxiety and PTSD symptoms. But I'm talking more of the chronic, overwhelming stresses that young people of today are exposed to as a mechanism to which they kind of pass that point of overwhelm and go into depressed dissociative states. So I think, yes, to be aware of dissociation and understand as much as possible of freeze and flop states is very helpful. And the other question regarding transgenerational transmission of trauma, I think is also, of course, extremely, extremely important. Because if somebody has been subjected to severe trauma themselves and are dissociated, it's going to be much more difficult for that parent to be present, to be well regulated, to be attuned, to be able to hold the little one in a way so that a healthy attachment can develop, which is the biggest protection for a healthy neurodevelopment. So of course, there is a transgenerational transmission of trauma, and there are cycles to break, and there is a lot of work also that needs to be done, through all generations to process trauma, historical trauma, transgenerational transmission of trauma, and context-dependent trauma. Yes, it's definitely there.
Okay, just before we go on to the next question, I can't help just share something quickly that you may all have seen it, but not very recently, there was a new study released that showed how trauma is imprinted in the DNA and is passed down from, they had studied 3 generations, from grandmother to mother to grandchild through the line of the women, and showing that trauma was actually changing the DNA and that it was resulting in a different behavior even in the 3rd generation, they weren't able to, for example, concentrate as much and other things. So I'm sure you know a lot more than me about this, but it was the first time I had heard of that.
Epigenetic phenomena that you're talking about, which is real. And also I think it's hopeful in a way to know that there has been a lot of development the last 10, 15 years with regard to trauma therapy. It a lot that has been learned about the brain, where trauma is stored, the bottom-up regulation, how you can approach it. There are many modalities of trauma therapy that are highly effective. So it's not hopeless by any means, but of course it's better to intervene upstreams and prevent the trauma as much as possible. And we know the resilience factors are safe groups and connections and all those kind of protective factors that I mentioned in the presentation. So if we can strengthen that and prevent young people to get into loneliness and overwhelm, that's a bigger gain than to treat each individual case, of course. But still, that is important to know also, that this is not untreatable. It is actually the best prognosis of many of the psychiatric conditions.
So we got more questions here. We hope to get through them all. And Frederick is talking about also that there seem to be a lot more research now that shows links to the root causes of the metacrisis, and that shows that, like what you were speaking about, like the deep disconnect from self, each other, and nature, you know, that how that is feeding into our mental health. But he's also saying that, and some suggest that our mental health is being affected by a disconnect from past generations and future generations. And he'd like to hear your perspective on this.
I think that is a really important thing that I didn't bring up in this presentation, but that we are on a continuum, and there is a lot of ancestors that we all have that have lived before us, and we are going to be ancestors ourselves as well. And we're here to create a healthy environment for the generations to come, as many generations as possible to come. And we're not doing very well in that. And I think in many indigenous communities and in those kind of original instructions that I was talking about, the respect and the guidance from ancestors is a huge part. That is also one of the big losses that we have lost, where we could have gained information and understanding about a lot of things. And I think that's part of a context that, you know, we are programmed to forget a lot of things, and that's not, we need to remember, because there is, I stop there.
Good. So we've got a couple of questions about education. We'll be coming to those, but there's one here that it relates to what you were saying before. This is from Hedda, who says, do you, as a psychiatrist, think that you should work preventive as well? I mean, I'm thinking, referring here to psychiatrists in general rather than you personally. And if so, how can that be done?
Well, in my world, you know, if we could work only with preventive action, that would be the best. If we could intervene as early as possible with the parents to be, we were talking about the transgenerational transmission, and have them heal their traumas and improve their emotion regulation skills and their capacity to create safe environment for attachment to develop. And then if we can have healthy school systems where there is a healthcare system that can identify young people at risk early on and give them support and help in these kinds of group settings, like the TARA program or something similar, of course, that's ideal, and that would prevent a lot of young people to travel the whole path to child psychiatry. And I think I represent, and these are discussions that are happening at the clinic where I'm at also, that we are wishing for more prevention, of course, and that's more, it's preventing a lot of suffering, and it's also from a health economic system evident that must be worthwhile doing, but that's not what we see. In Sweden, things are going the other direction. We are dismantling a lot of the social welfare structure that was built up here for decades. So I think that's also part of why the numbers of young people who actually seek help within psychiatry has increased, because the prevention has been minimized.
Yeah. There's a question here from Margaret, which is very precise about the research you're doing. And she's asking, can we join your group research? She's been wanting to do groups with young people. Is that something that's possible?
Yeah, so the main thing that I've been working with is the TARA program. And it's, as I said, it's been taking years and years, and it's been happening at the University of San Francisco, California, UCSF, and it's been happening up at Umeå University. And we've done one of those big randomized controlled trials now where we actually test out TARA as compared to treatment as usual, which is often medication and CBT. And we don't have the results yet. And I've been so extremely tempted many times to say that I put the research on a shelf and I go out in the world and go on my gut feeling and try to create these groups, because I believe that they help. And then something in me has been kind of saying, stop, you've come this far, so why not wait for the results, or wait until at least we know that not people are being harmed with this kind of methods, or at least that it is equally good as the treatment that is offered in psychiatry. Then we can create programs online, or we can kind of teach the principles of these programs with more confidence. Otherwise, we also risk, since we live in this metacrisis ideology, that something that is not proven by science is not true. It's like I have been thinking that maybe we would reach more people by having a methodology that is evidence-based. I'm not so sure anymore. I don't know what would have been the best. This was my choice at that time. And within a year or 2 years, I think we'll be able to, promote these teachings for parents or schools or communities or so. I hope so. And not to say that this is the only model, because I really want to say that it's the principles that I've tried to convey today that are important, and I don't want to kind of sell a program because this needs to be adapted for local communities and needs to be kind of done in an action research way, so that it lands well, with a lot of humility. It's not that I can come from academia and tell people what to do. I need to kind of draw on their own wisdom and try to inform about basic principles and what I've seen simply.
Okay, so we've got 4 more questions, and we're sort of starting to run out of time, but we aim to do all the questions, address all the questions.
Yes.
Please stay with us. I'm jumping in the order according to what I think is a logical order, so don't fear, we will get to your question. Here's someone from, I don't know who it is, from Apple iPad. And this is relating to, I think, parental abuse. And this person is saying, I cannot help thinking that the scale of current abuse is quite new, that there's a bigger scale now, and that people seem to imprint a bullying behavior that have been, received bullying behavior, they become bad parents if they have been parented badly. I.e., abuse can spread fast, even ignoring epigenetics. Can you comment on this and on that prevalence of, is the scale of it new, or is it something that just wasn't noticeable before?
Oh, it's a difficult one. I think it depends, where you have grown up and which part in the world you would have lived in. I speak from Sweden, which is a very privileged position in the world, where we have had a relative social welfare state and lots of resources. And from my perspective, up here north, in the global north, I can see that things are unraveling and that we don't provide the same kind of preventive action that we have done, for instance. But if you would have lived in another part of the world, in a war zone, or where there have been famine, or where something else has happened, it could have been a very, very different situation. So I find it hard to put it in a contextual time frame without looking to where where it has happened. But what I can say is that things are escalating due to the metacrisis, because we are reaching tipping points, and we are having more and more of those double binds, and people are being more and more entrapped in behaviors and life situations where they don't feel belonging, where they don't want to be. And we are quickly, in this debt-based economy, approaching states where, to maintaining this economic growth, it's going to be more destruction of the ecosystems. So the pressure worldwide will increase and is increasing, and that's, I think, what we're actually seeing right now, and that will create, in those, again, the Bronfenbrenner circles, increased pressure on the individual. So even if you live in a privileged or relatively privileged part of the world, this will be felt. And I think this is why Local Future does such an amazing job in promoting localization and promoting and strengthening local community and land-based practices, because that's what's going to be true. Everything that is happening out there, we don't know what's true and what not true. And it's very hard to navigate and orientate, increasingly difficult. So I think maybe this was a confusing answer, but I think whether it has been increasing or not depends on which part of the world you've lived your life. And I think, yes, in total, the pressure increases due to the metacrisis and the driving ideology that we're subjected to and part of. Yes.
Yeah. So adding to that, I read recently about a lot of escalating in a family violence in Gaza, and there's a direct correlation with the war situation people are facing.
Of course.
Yeah, which is
yeah.
So that's one very sad example. We've now got two questions relating to education and the role of education in this. And I'd like to just share both of them so that you can, I think, address them together. So one is from Dita, who asks, how can the education system adapt and support our young people with these challenges? Dita is in Portugal. And the other one is from Alexandra, I don't know where. She says, are you aware of any sort of research that is informing policy on education at a national or international level relating to the mental health? And she's commenting, and she says, I'm concerned with the way in which very young people are becoming overwhelmed at school as well, and not educating them in how to live well in this society, or at least how to cope, right?
Yeah.
So those are the two questions.
Yeah, I mean, I don't know what to say. I can just agree that I think what we are it's very hard to be a parent or a teacher in this age, because we are in this volatility and this unpredictability. We've never been here before as a species. And what we're handing over is the old matrix. It's the old ways to success, or the old ways to educate oneself. And maybe it's not relevant or applicable the same way anymore. I think one thing that really should be part of a curriculum in any sane society is how to practice emotion regulation, how to understand about the metacrisis, the water we swim in, to understand ideology and how that impacts, to analyze power structures, for instance, to learn how to navigate in this world, and to learn how to feel what's true for oneself, and not be kind of governed by these algorithms that is driving the global economy. We are being colonized, not just as a working force, but our minds are being colonized, our behaviors are being colonized. And to resist that, the first step is to recognize what's going on. And I think this can actually be taught in schools, at least in schools that are not part of the dominating paradigm, because that's the problem. If the school actually is promoting and being an extension of this ideology that I've attempted to line out, then we do have a real problem. And then perhaps there is aspects of deschooling that is needed, or deprogramming, or somebody suggested, garden, community gardening, or going out in the forest to learn about living things, or you name it. There could be many things that would actually give young people experiences to hold on to what life is actually about, and not just learn how to be productive in this economic system to survive. Because that's the typical example of the double bind. Young people know that they need to learn how to be, a good citizen, or somebody who can earn money in this system. And at the same time, they know that the system is rigged and flawed and not sustainable. And what are they going to do? They're left with this double bind. And by naming it and talking about it, at least we can help them stand up for themselves, or come together and name these problems and activate, instead of just passively follow and then develop mental health problems. So I think this is a huge issue, and I do not have the answers. I know, and we are kind of in the midst of it. So I also think that just by having these kinds of discussions, something is being developed, because it's huge. It's huge. It's like to try to shift the course of a big ship. It takes time to make that maneuver.
Yeah, I can say, as someone who's been involved in quite a lot of sort of alternative education, also with small children and adolescent, that a lot of those that do kind of alternative schooling are sort of tackling this, because they, by trying to prepare people for the world we need and not the world we have.
Exactly.
But I like you, I think it's a very big ship to turn around, and mainstream. We are still being sold this idea that we just need to do a little bit of techno fix and everything is going to be all right. There isn't that recognition that the world as we know it is collapsing, which is what you're speaking about. And I'm personally very inspired, and lots of people here are writing similar things. And I think a lot of what you've been sharing today here can be really helpful for all of us in the different aspects that we are working to include that and name it.
I think the naming of it is so empowering. Even though we live in the double bind, at least naming that maybe the educational system needs an upgrade, and maybe what this young person is feeling is completely normal and adequate. And maybe it's like we are updated, we are handing over something that is not valid anymore, and we need to learn from them. It's like we need to be in a state of humility, because they are going to inherit the future that we are handing over to them. It's not their fault, and we can't blame them and say that they are psychiatrically ill. they, it's like it's so wicked the way things have turned out. And I think the first step is to name it and to listen to them.
Yeah, very key. So 3 questions or comments here left, and one is from Fabienne, who says, is there such, or can you comment on healthy stress? Is there healthy stress?
Yes, of course. Every time we are challenged, we need to mobilize, and then our sympathetic nervous system will get activated, and we will get some increase of blood pressure, some increase of our heart rate, and all of that is good. If we go and run for a big run, we will stress our systems. If we take a swim in cold water, we will increase our stress. If we are on a low-calorie diet for a few days, we will increase the stress, and that's good for the system. Stress is not dangerous. Stress is very, very healthy, and we need it to develop and to adapt and to challenge ourselves. The problem is if we never come back to baseline. So I'm not saying that we're not supposed to stress. I'm saying stress is good, but we need to come back to a state where we can restore, where we can fill our energy reserves, where we can integrate what we have experienced, where we can heal injuries, where we can have our memory reconsolidate in the brain during night when we sleep. All of these processes that happen in the body moment to moment, about cell generation, about inflammatory processes, all of that needs as optimal conditions as possible for us to stay healthy. And it's a super complex system. So we need to learn to listen to our body. And yes, we should push it and we should challenge it. We can stress out, but then we need to rest. And if we are in the freeze state, if we have already gone over the point of overwhelm and we feel both anxiety and collapse and tiredness, then it's a very difficult state to be in. It's almost the worst state, because when we try to rest, our anxiety levels will increase. So it's very hard to recover in that state. The more we do not do anything, the more panic we will get, so to speak. And that's the time where we should seek help and support to come out of that state and back to baseline. And ideally, we do that before we start to build up a depth in the body. It's called the allostatic load, where we stress out and we come up to here and we go down a little bit, and then we stress out again and we go up to here and down a little bit, and then it increases, but it never comes down to zero. It never comes down to deep rest. And then we tax our system, and then in the end we get ill. So yes, stress is good, but also the non-stress state.
Rest is necessary.
Yes.
So here at the end, 2 more. Taiko is saying, is a yoga teacher and has started giving classes that are trauma sensitive informed. It's something from approach by David Emerson. Is that something you're familiar with? Do you use something like that in your work?
Yes, I'm also trained in trauma sensitive yoga, and I think that has a lot of wisdom in it. I think it works well for some people, and for some people, yoga can feel like a little bit. So it seemed to me like young people have different needs, and some need to dance or move in less structured ways, and some young people may have physical limitations or overweight or pain or something that they are ashamed of that makes it really difficult for them to be in a group doing yoga together. But I think the trauma-informed practices are taking care of some of this, but sometimes it's not even possible to get young people into such groups from my experience, and then we need to rethink and do other kinds of movements. And when we have yoga-based practices in the Tara program, it's super simple. It's really designed so that nobody can fail. and it's very emphasized that it's not about being good at doing yoga. It's about actually doing the practice and being with yourself where you are and nothing else, not comparing oneself to another, not getting further in a series, or actually it's just a moving meditation and a way to get to know oneself and how the body reacts, and to kind of mobilize out of the freeze states. So we can do like raise your arms and breathe in and come down 3 times. And that would be a yoga practice. So it's not like doing long series of advanced yoga asanas or anything like that.
So just to say that a lot of really interesting comments in the chat that Eva and I haven't been able to read while during the session, but we will read them. And it's very inspiring to see all that all of you are doing.
I'm so curious. I wish I could hear from everyone.
Yeah. But we will look at it, and you will all get a recording of this session and of the chat as well. So here to the ending, I think there's a very pertinent comment here at the end from a grandmother of a girl of 10 who is wondering what kind of conversations to have with her grandchild at this age. How much should one be discussing about the existential threats that we face as adults, as young people as well? What kind of preventative conversations, activities, stories should we approach? And also, well, again, one of many that are thanking you for a really heartfelt presentation. And I mean, there's so many comments here about your inspiring presentation and all that you have shared. So, it's we really appreciate it.
It resonates. Yeah.
And not to forget, I just want to air it here, like 900 people signed up to this series, and we can see that people are actually watching the recordings afterwards. Not everybody can be here present. So anyway, what you're saying is important for many, many, many people. So back to this thing about what do we do with our young people?
Yeah, I can very much relate to being a grandmother, and I think it's not so much, it depends on the age, of course, but the first thing is to create a safe relationship, and not to impose anything, but just to listen, and listen with great humility to this other being who is going to inherit the future, and to try to understand their understanding or experiences of being in the world, asking them questions about what's important for them, what is challenging for them, what is inspiring for them, who are they learning from, who are their heroes, all these kinds of things. What are their problems and their challenging, and by asking them and to listen to them, and to listen all to their body language and not impose oneself. Sometimes I can feel that I am imposing myself because I want to create a relationship, instead of kind of being super sensitive to allowing space for them to come and go, and to be where they are with their lives. And then when and if they start to ask us questions, I think to be as authentic and honest as possible, and not to try to sugarcoat reality, or sometimes we can ask why they ask, and get even more information about what their worries are. But mainly it's about creating a relationship where they feel that we can hold for whatever they want to share. So I think in this role of being a mother and a grandmother and a father or a grandfather is to practice these kinds of things for oneself also, to be able to emotionally regulate, to process grief, to sit with uncertainty, and still be in support. still not flicker, but still be there. I think that's one of the most important contribution that we can do, and it's a tough practice.
And I would say from my experience, I've been working with a lot of children and also in my own life. If you have the opportunity to connect really with nature, maybe growing some food or being part of a community garden or reforestation, it just takes a bit off the pressure, because you can actually see real results. You can see that the nurturing and caring, in this case for the soil and the plants, can have amazing results. So
yeah, I love that, Anja, and that's a way to kind of honor life also. Like this is all life is happening all over as we are having all these problems.
Exactly.
Trees are still growing, and carrots.
And we can still heal things and heal ourselves in the process.
Yeah, I love it. And also I forgot to say play. For God's sake, play and play music and tell stories. And I mean, this is all very heavy material. I realize that, but bringing joy in and cooking breakfast or whatever it takes.
Well, I think we all leave inspired here. I can see everybody else do, and I certainly do. And I'm looking forward to taking forward some of the things that you've shared here today. I feel like, it's a really big part of the puzzle of how we deal with this time of transition and with all the trauma and disasters that we are facing. Thank you so much, Eva.